You clicked on this video. Today we'll be talking about the anatomy of the scalp. The scalp, 5 layers: skin, connective tissue, aponeurosis, loose orbital tissue, and pericranium. Covers Calvaria, posteriorly superior nostril lines, anteriorly supraorbital margin, laterally temporal fossa to zygomatic arches. First 3 layers, skin, connective tissue, and aponeurosis, move together. Layers of the scalp: skin, outermost layer, hair bearing. Unless you're bald, then it's an hair bearing. Connective tissue, fibrofatty with fibrous septa connecting skin to underlying aponeurosis, contains many arteries and veins, branches of external and internal carotid arteries, and form a free anastomosis. Aponeurosis, thin tendinitis sheath that unites occipital and frontal bellies. Occipital frontalis muscles. Lateral margins are attached to temporal fossa. Loose auricular tissue occupies subaponeurosis space, which is a space beneath aponeurosis. Loosely connects aponeurosis to pericranium and contains some arteries and emissary veins. Emissary veins, valveless veins that connect superficial veins of scalp with diploic veins of skull bones and intracranial venous sinuses. Pericranium, outer covering of skull. Muscles of scalp: occipital frontalis. Origin: has 4 bellies, 2 occipital and 2 frontal, connected by aponeurosis. Occipital bellies smaller, arising from highest nostril line on occipital bone and attaching to aponeurosis. Frontal bellies larger, arising from skin and superficial fossa of eyebrows and attaching backward to aponeurosis. Nerve supply: occipital belly, posterior branch of auricular nerve. Frontal belly, temporal branch of facial nerve. Action: the loose auricular tissue allows first 3 layers of scalp to move forward or backward on pericardium. The frontal bellies can raise eyebrows, an action done by the temporal branch of facial nerve. Nerve supply: main trunks of sensory nerves are found in superficial fossa. From ophthalmic division of trigeminal nerve. Supratrochlear nerve supplies scalp near median plane, reaching vertex. Supraorbital nerve supplies scalp over forehead as far as vertex. From maxillary division of trigeminal nerve. Zygomaticotemporal nerve supplies scalp over temple. From mandibular division of trigeminal nerve. Auriculotemporal nerve supplies skin over temporal lesion. From clavicle plexus, lesser occipital nerve, occipital lesion, and medial surface of auricular. From posterior ramus of second clavicle nerve, greater occipital nerve supplies skin over back of scalp, reaching as high as vertex. Artery supply: located in superficial fossa. 5 arteries enter scalp on each side, 3 in front of areolar and 2 behind. From ophthalmic artery, a branch of internal carotid artery. Supratrochlear artery. Supraorbital. From external carotid artery branches. Superficial temporal artery, branch of ECA, ascends in front of auricle and divides into anterior and posterior branches, supplying frontal and temporal lesions. Posterior auricular artery ascends behind auricle to supply scalp above and behind. Occipital artery ascends from posterior triangle and supplies back of the scalp, reaching vertex. Venous drainage: the veins of the scalp and intracranial venous sinuses via valveless emissary veins. Supratracheal and supraorbital veins make facial vein. Superficial temporal vein and maxillary vein make retromandibular vein. Posterior auricular vein and posterior division of retromandibular vein make external jugular vein. Occipital vein drains into suboccipital venous plexus, then drains into vertebral veins or internal jugular vein. Lymph drainage. Lymph vessels in anterior and forehead drain in submandibular lymph nodes. Drainage from lateral scalp above ear goes into superior parotid nodes. Lymph vessels from scalp above and behind ear drain into mastoid nodes. Vessels in back of scalp drain into occipital nodes or drain into deep clavicle lymph nodes.